Thank you for the opportunity to be here. I'm President and CEO of the Healthcare Association of Hawaii. We represent every hospital in the state, public, private, even Triple Army Medical Center is one of ours. We also represent all the long-term care facilities in the state, all the hospice agencies, home health agencies, and almost all the assisted living facilities. So my perspective today is coming from that healthcare industry. Today, we have about 2,400 inpatients in our hospitals across the state. That's about what we're running right now, about 2,400 inpatients. And we have just over 3,200 long-term care residents in our skilled nursing facilities across the state. They are just some of the statistics, but they are the people who are taking care of those 2,400 inpatients and those 3,200 long-term care members are the people we're concerned about, in addition to home health, hospice, and assisted living. So marijuana has an impact on the brain. If it didn't, people would not use it. It's an addictive drug. It's been demonstrated to be an addictive drug. And as you've heard today, the marijuana that's consumed today is many times more potent than it was decades ago. And this is what I want to focus on in just a few minutes I have today. And from the healthcare perspective, from all of those thousands of people today in Hawaii who are taking care of patients in all different settings across the state. It has an immediate impact, and this is documented. There's the journal articles, many of them in the, that were referenced in the earlier presentation. It has immediate impact on thinking, attention, memory, coordination, movement, and time perception. It can cause permanent IQ loss and interferes with a person's ability to learn and perform complicated tasks that are being performed every single day in our institutions across the state. It disrupts functioning of brain areas that regulates balance, posture, coordination, and reaction time. It does affect brain development, has been demonstrated to impact brain development, and it can damage lung tissue and can be detected in blood and urine for up to a month after use. So trying to discern if someone was high because they have ingested some form of THC, or if they, did they do that the day before, the week before, is incredibly challenging because of how long it stays in the body and how long it can be detected. Now, marijuana in Hawaii was legalized for medical use in 2000. It was legally available in 2016. And as of yesterday, according to the Department of Health, we have almost 3,300 valid medical cannabis registrations in Hawaii. Now, it can be effective in relieving nausea and vomiting and other pain and spasticity associated with multiple sclerosis, along with other things. So employees who tested positive for marijuana, this is not just the healthcare workforce, this is in the workforce in general, had 55% more industrial accidents and 85% more injuries compared to those who tested negative. That's from JAMA, Journal of American Medicine. So my question is, as we talk about this topic, and as we have people who are in our hospitals and our long-term care facilities and our nurses going into people's homes to take care of people, and as we're caring for people as they're dying in our hospices, what impact would this have on our ability to take care of, coordinate care for those patients, making sure they're getting the right medications, whether it's just something as simple as getting an injection or a vaccination, whether it's something as simple as getting a blood drawn. When we get blood drawn, I don't know about you, I don't want someone trying 4 times to get the needle into my vein. I like them to get it on the first try. Whether it's someone who's undergoing anesthesia for surgery, someone who's been a technician who's taking care of a patient for MRIs, CT, X-rays, ultrasounds, for anyone who's undergoing surgery, for anyone who is being cared for in a complex medical environment. So in summary, marijuana has an impact on the brain. If it didn't, people wouldn't use it. Legalization increases, and you've heard some of these comments, increases acceptability, availability, and use. It has been demonstrated to affect short-term memory and cognitive abilities. It leads to poorer educational outcomes. It exacerbates ethnic disparities. I thought that we were working to reduce ethnic disparities in our communities. It leads to increased ER visits and hospitalizations. Our hospitals, today we have about 2,400 patients in our hospitals. Like I said, pre-pandemic we had about 2,000 patients a day in our hospitals. Each day now we are taking care of 400 more patients a day than what we were doing back in 2019 and 2020. Our hospitals are already full. We don't need more patients. We could build more hospitals, but that means all of us are going to be paying for all of that extra care. It increases exposure to children and calls to poison control centers and increases the disease burden in the community. You heard from Dr. Miskovich. Public health, we're working to reduce the disease burden in our community. Thank you.